SiriusXM. It's time for Weird Medicine with Dr. Steve. Weird Medicine.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heartburn, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve! Yo-hee-yo. Take a countful. Yo-ho-ho-yo. To the vertebrae. Yo-hee-yo. I need some suction. Yo-ho-ho-yo. In the carotid. Yo-hee-yo. I bring the crash car. Yo-ho-ho-yo. And do the kung fu. Yo-hee-yo. With the shot pack. Yo-ho-ho-yo. Dr. Steve!
From the bull testicles as part of a nutritious breakfast capital of the world, it's Weird Medicine, the first and still only uncensored medical show in the history of radio. I'm Dr. Steve with my little pal P.A. John. Hello, John.
Hello, Steve.
And I have with me in the studio the lovely and talented G-Bag.
Good evening.
And also Dr. Scott, who is a traditional Chinese medical specialist. Hello, Scott.
Good evening, sir.
On sabbatical, Jefferson the Shyster, and Addictomy Todd, also known as Fecalicious, the master barber with multiple penis tattoos on his arm. I'm going to call him Addictomy Turd tonight. He's at a Flogging Molly concert. So.
Oh,
he's going to be flogging.
Hey, we're missing that.
I know.
Jeez.
I'll tell you what, though, coming up soon is Cannibal Corpse. I'm going to be there for that. It's right down, not too far from us in Asheville, North Carolina.
At the Orange Peel?
At the Orange Peel.
Mm-hmm.
Nice.
And the other thing is Guar. We're going to go see Guar.
Oh, God. I remember.
I've seen Guar 4 times at Dragon Con in Atlanta. So
Why?
Because they were there and it was free. But they're awesome. Guar is fantastic.
Do you have anything that we could sample, listen to?
I did. Shit. No, I should. But you can go online and apparently the name Guar is an acronym for God, what a racket. And when I saw them, they kept chopping this guy's head off, and blood would spray all over the stage and into the crowd. And there's still in this reception hall in this hotel in Atlanta, there's blood or stage blood on the ceiling that's at least 20, 30 feet away from the stage.
Oh, my word.
And that's just still there because they can't clean it off.
That's fantastic.
So Guar's awesome. So we're going. And you're going, P.A. John. You're going to see either Cannibal Corpse or Guar. So
since my wife has had the chemo, she lost her hair, we've thought about dressing up with some tattoos on the neck, the piercing type of thing, all black leather.
Hell yeah.
Doing some eyeshadow, whatever it is they put on.
And then
eyes,
doing what?
Going out in town just to see what kind of reactions we get.
Yeah.
So I was thinking your partners would love that.
You could
Yes.
in the orthopedic office.
I was going to say his partners would love.
Obviously, that would not be something you'd try.
I think you could take her to a strip club and see what the reaction is.
Right.
Basically, you're going to get the same reaction that you get wherever you go. People just, with this sort of bewildered look on their face. This is a show for people who would never listen to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, or if you just can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POO-HEAD. And visit our website at weirdmedicine.com for podcasts, medical news, and stuff you could buy. I can't mention because we have a contract with SiriusXM. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, acupuncturist, physician's assistant, yoga master, or whatever. So, couple of things. GVAC, tonight you are playing the part of double vasectomy Todd, which is to play the part of the layman. So if we throw out any jargon or something, you need to call us on
Well
it. Because
understood.
sometimes doctors and other medical providers will throw out jargon without even realizing we're doing it. And that's usually Todd's job, is to go, whoa, wait a minute. But now that he's a master barber, we have to watch out he's throwing out, barber jargon. So we have to call him on that
Yeah, I
shit.
think I was impressed with his knowledge of.
He knows some stuff.
Yeah, the hair stuff and the scalp stuff.
Well, in Western medicine, the barbers were among the first quote-unquote healers in Western medicine, and they used to do all the bleeding and stuff. And he told the story on the air, that's where the barber pole comes from, is after they would bleed people, they would hang the gauze strips up outside to dry. So, of course, they could use them again. And so that sort of red and white stripe, you hang it up on a white pole with the red stripes hanging down, and the next thing you know, that's the sign that there's a barber nearby that's bleeding people.
Wow. I was trained to bleed people.
Is that right?
I sure was. People with high fevers, they'd bring them in kind of acutely.
Yeah.
We'd bleed their fingers and their toes.
Huh.
And we sure were.
Do you do
Just
that
leak some blood out.
moxibustion shit?
I do.
But I mean that. I'm sorry. I mean that moxibustion procedure.
Please,
And what is
Dr.
that?
Steve, it's such a
That's all right. Now explain that.
Yeah, explain what moxibustion is.
Moxibustion it's called Iya, but it's a dried chrysanthemum leaf. And I actually only use it just a couple times a year because it smells like pot. And I'm always afraid somebody's going to come walking down the hall.
Think that you've been smoking.
Yeah, I've been back there stoned, but what it is, I only use it to try and turn babies in utero that are breech.
Okay, so they're coming out ass first.
Yeah, exactly. They're coming out ass first or feet first.
Okay, explain this to me.
You're
burning leaves and somehow turning this kid around.
pretty much.
Tell us
pretty
how
much.
that works.
There's a little bitty point on the outside of the small toe. You put a needle in there, and then you rub this little moxa stick. It's
small toe of the mother?
The mother, yeah.
No,
Yeah,
he's
the mother.
sticking it in the
That's what I was
uterus.
Oh yeah, yeah.
saying.
Oh no, I apologize. No, it's of the mother.
baby's
Of the mother, yep, of the mother. And I'll only do it when they're at least 38 weeks.
Okay.
And with permission from whoever their OBGYN doc is. But if somebody is good, a perfectly healthy baby, and ultrasound show that everything's clear, they got good amniotic fluid and no cords around their neck. We hope we can turn it or try to turn it without doing any manual manipulation. And all it is it just irritates the fetus enough to where and hope that we can turn them. And
So-
I'll tell you, I've done some really interesting things with
Now,
with
is it
in-utero
like an
babies
incest
before.
stick?
It
that
is
you
like
stick on their foot?
very much like an incense. Yeah. Now, that's why it smells like marijuana. It's terrible. But now I was trained to do it where this is the truth. I was trained to do it where you put the needle in the body and you put a little piece of this moxa on top of the needle and you burn it. You set it on fire. And guess how many times I've done that?
Yeah.
Yeah.
Well, okay, that's not what I was thinking of then. What's the thing where they use the little glass jars and you
It's
burn
cupping.
Okay,
Cupping.
what's the deal with that?
Well, you know what? I use the cupping a lot. Like if someone has a boil and I'm going to lance a boil, or if I have somebody that's needle phobic, then what you can actually do is you can put like a flaming ball of alcohol inside of a cup.
Right.
It creates a vacuum. It takes up all the available oxygen, and as soon as you pull it out, you put it right on the skin, and it sucks the skin and the muscles up into the cup, and it's really beneficial, especially if somebody's got an acute muscle spasm in the lower back. It's wonderful.
Huh.
Wonderful.
Now, I've seen
Wonderful.
pictures of people who are having that done, and they've
Yeah.
got these rows of cups down their back.
That's
looks,
exactly what I do. Yeah.
Is that right?
Yeah, it is. And it works really well for certain things. Yeah.
I know why. After hearing the what is it,
Moxibustion.
Moxibustion, yeah. Moxibustion, yeah.
I know how that would work.
Yeah.
You stick a needle in someone's toe, they're
Yeah.
gonna cringe a little bit, and
Yeah.
that's got to do something to the vaginal walls.
The vaginal
And when
walls.
the vaginal walls start tensioning, and that baby gets a twistling,
Yeah.
something's gonna be happening.
Some's happening. That's
Wow.
exactly right.
It's been a long time since I've been in studio, huh?
That may be right.
You have been on sabbatical. How's everything going?
Things are going pretty good.
Now-
Actually, we're heading to recovery, I
Good.
believe.
Now, for people who don't know, P.A. John's wife is P.A. Jill, who used to be on the show, and she has ovarian cancer.
Yep.
And but it was stage 1. They caught it early, even though they sat on it for a year.
Right.
And she had the surgery, and then she's had the chemo.
Yep.
And she had a complication that we'll talk about next time she's here in the studio. She wants to talk about it herself.
Right.
But it's one of the most horrific complications. I'm just going to tease this so you listen. We'll have her on maybe in 2-3 weeks.
And obviously, I've cursed on the show before, but I'm getting ready to say this is one of those "holy fuck, are you kidding me?" things. Even from a medical
we won't talk
standpoint.
about it anymore because it's unfair to the audience. But it's the most horrific surgical complication I've ever heard of, and she's fine. So that's the good news. She's fine. She looks great.
Run. Yeah, still healing. But
she has no hair, and the cool thing is, Jill is so. Beautiful that she doesn't need hair. She looks great. She looks really good.
Yeah, John outpunted his coverage, didn't he?
Did he?
I think he outpunted his coverage
He
on that deal.
absolutely did. He traded way up.
He did, yeah.
So,
he did good.
Well done. It did. Did your mom ever catch you guys beating off?
That's a hell of a transition.
No, we don't need no stinking segue.
Is this a general question or just for John?
No, I'm just curious because
if she did, she never told me, or I never got busted. Like, what's his name? The comic on O&A that has the accent.
Jim Jeffries.
Jim Jeffries. Well, I think that's what made
his
me think about it.
Mom running in the room and he's completely naked under the covers in 100-degree weather.
And he laid down on his stomach, and she's like, "Turn over, turn over."
Yeah, no, I don't have an episode like that.
Yeah,
no.
Okay.
Why, something...
Scott?
Nothing like that.
Well, that's a bust. Okay, next topic.
Wait, something deeply rooted in your psyche, Doc?
No, I got caught once. Yeah, I got caught once. I was beaten off to a Sears bra catalog.
Oh, yeah.
And I think back then,
I remember
swear
those.
to God, I think Cheryl Teagues was a Sears bra person, because when she came out, I recognized her because I think I had jerked it to her a bunch of times.
That famous poster?
I used to look through, oh my God, I used to look through, if I couldn't get my hands on a Playboy, it was like I had to deal with whatever magazines happened to be lying around, and I would flip through those page after page just looking for some cleavage or
It's the best part of Christmas, wasn't it? The big Sears catalog, because they had
the Sears catalog was awesome.
It was beautiful.
And whoever was the art director back then, they loved, the young girls with big tits.
Oh, yeah.
And, oh, man, that damn bra catalog. I know.
I think things have changed now. Everybody's skinny.
Victoria's Secret's about the only thing catalog that still shows curvy women, unless you get a plus-size catalog or something. So many of these things are just really like these wafy, skinny girls.
It's terrible.
Well, it's if you're a wafy, skinny girl, good for you. And there are men out there that like that kind of thing. But boy, that's Sears catalog.
Good
so
memories.
I'm jerking it, and I was sick. I think I was sick. I was homesick, and I didn't have anything to do. So I said, well, I'll just beat off. And then I hear my mom coming up, and I threw the magazine under the bed real quick and jumped in bed, but I jumped in bed just a little bit too late. She was already opening the door and walking in, and she saw my she saw my boner, tenting up my pajama pants. And she just looked at me and said, "Do something constructive." So that was it. That was
Your answer should have been, if you would have given me 5 minutes, I would have had a finished product.
That's right. I was trying to do something constructive.
That is beautiful.
All right. Well, listen, I'm going to tweet out. We're taking live calls, and I'm going to tweet that out right now, and I'll keep an eye on the Skype. If you're listening on Sirius XM, you can't call in. You can call in, but you can leave a voicemail. But while we're recording, we're going to try to take some live calls, see how it goes. So we'll see. But if you have a question you'd like to throw our way, call us at 347-POOHEAD. That's 347-766-4323. And let's get some wisdom from the great Ron Bennington.
Number one thing, don't take advice from some asshole on the radio.
All right, and we will not do that. So, all right. Well, shit.
Hi, Dr. Steve. My name is Casey. I had a question. Throughout my life, whenever I had...
Oh, wait a minute. Before we go on, what are we drinking tonight?
Oh, can we?
Yeah, I know. You can say it.
That's it.
You brought a growler. Dr. Scott brought a growler.
From Rogue Distillery. It's their chocolate stout.
Nice.
It's beautiful.
It is. It is a really beautiful thing.
And the Rogue Distillery makes some really, really nice beers.
Yeah, they do.
And I tell you, the chocolate stout is just.
I love their
top
Dead
notch.
Guy Ale.
Yeah,
Do they make Arrogant Bastard? Or is that somebody else?
No, that's somebody else. They make the Dead Guy Ale and they make the chocolate and God, they make. But you know,
Who makes Arrogant Bastard?
Stone.
Oh, it's Stone. That's right. I get the two confused sometimes.
they make a hazelnut that on tap is just like the divine nectar of the gods.
Really?
Oh my word! It's just
Now that I haven't tried.
Yeah, you'll have to.
I really like Rogue products. I love Stone, the Stone IPA.
Oh yeah.
And what the? Oh boy! I hope I didn't give out the wrong number. Did I just give out my home number?
I was gonna say I hear another phone ringing, but I don't think it's the right phone.
Oh, here we go. Well, let's give this a try. So 781 area code. You're on Weird Medicine.
Hey, Dr. Steve, it's Pat from Boston.
Hey, Pat. How's it going, man?
Good, man. I tweeted you earlier today, and I figured I'd call you since I saw you're going live. I have lupus, and I was wondering if it's common for somebody to get heartburn more from that or from Plaquenil, the medication that you actually take for lupus. Do you know anything about that, or?
Well, yeah. I mean, lupus is a connective tissue disorder. It does, causes inflammation in lots of different parts of the body. And I would have to look that up for you, and I'd be happy to do that. And just email me at weirdmedicinexm@gmail.com, and I'll look whether there's a connection between lupus and reflux. I wouldn't be surprised. What are you going to say, John?
Well, I was thinking just in my thought process, I don't deal with that on a regular basis, but I would believe that I would say you probably have two different issues. I think you probably have your lupus, but I don't believe, in my personal opinion, I would believe it probably wouldn't be connected. I would think that you may just have some reflux, whether it be just from GERD, stomach irritation.
Do you get it like at certain times of the day, or as far as the
sometimes it comes on rather randomly. I might not have eaten anything. It doesn't seem to be any rhyme or reason to it. Like I'll randomly just be at work, and all of a sudden I'll have really bad heartburn. I'll have to eat a couple Tums. It doesn't really do anything.
So is it more burning, or is it like a belching or something?
It's like my esophagus is like burning. I don't know.
I think one of the side effects of Plaquenil can be some GERD, or certainly some.
Plaquenil can cause nausea, vomiting, and diarrhea. It can cause hair bleaching. Oh, you do? Okay.
Yeah, from time to time, yeah.
But reflux esophagitis is one of the most common complaints in the United States. That's why Prevacid and Prilosec and Dexilant are among the most highly prescribed drugs in the country, and you have the same risk of having that as anybody else. And whatever the cause, I would treat it the same way. Now, here's the problem with Tums. Tums have calcium in them. Calcium is a hormone to the stomach, which causes the stomach to produce more acid. So the more Tums you take, the more acid you're going to produce. So I would rather you use an acid reducer like Zantac or one of those medications, obviously under the supervision of a doctor, rather than using Tums. Tums are okay for like once a month use, but if you're using them all the time, it's just going to make things worse.
Yeah, I was going to say, and I'd like to give you some quick advice too, some things just to neutralize acid.
And you are, Pat, the person talking to you right now is Dr. Scott, and he's a traditional Chinese medicine guy. We don't always agree on everything, but he's a pretty cool guy.
Yeah,
I'm familiar with Dr. Scott. Yeah, I've heard him a few times on your show.
Okay.
Well, I tell you what, a couple things real quick. Warm foods and warm drinks help with reflux and the motility of the stomach, number one. So try to have warm foods and warm drinks. And if you're having an acute episode, if you don't have access to some of these things, just plain yellow mustard the turmeric,
Yellow
and
mustard,
plain yellow mustard, a shot
What
of
do you
that.
mean? You mean like French's?
Just plain yellow French's mustard will flatten,
So I
neutralize
can squirt
it.
a bottle of French's in my mouth and I should be fine with my acid reflux.
I tell you what, you're in Boston. Maybe if you can find a little street vendor that's got a little packet of the yellow mustard, just squirt it in your mouth. That'll neutralize it on the spot.
Are you fucking shitting
I
me?
swear to you. I swear to you.
That doesn't sound right, but I'll give it a shot.
Honest truth.
I don't think it can do any. I don't think
Plain
it can do
yellow
any harm.
mustard will absolutely neutralize it.
That's give it a shot and call us back and tell
That's
us how
right.
it works.
Hey, I tell you what, take a double shot of mustard and call us in the morning. I think that's the way to do it. But try the warm foods and the warm drinks, because I think that'll increase your stomach motility and you'll feel a lot better. I see this every day.
I will
all
say,
day.
Dr. Scott gave me this advice years ago, and I stopped drinking at lunch iced tea with ice. I started drinking it warm, warm tea. And I can tell you that my abdominal pain is much, much better doing that.
It does help.
And if you want a layman's advice, bro, I'm just going to tell you right now, cut out the carbs. I've cut out carbs, and I haven't had an ounce of heartburn or stomach problems.
Yeah, and that everybody that goes on a low-carb diet will tell you the same thing. If they had reflux before, the reflux goes away by reducing the carbs in their diet. And one thing you can do, you don't have to go to a complete Atkins diet, but if you notice that your reflux is worse at night when you lay down, just don't eat don't eat bread and sweets with your evening meal.
Yep. And I think he said he was sensitive to the milk products anyway. So
yes.
I would be concerned that he's got maybe a gluten sensitivity. If he's got a milk
if it's
sensitivity.
milk problems, it'd be more like lactose.
Yeah.
I mean, there's no gluten in milk. So.
No, but I think that the end of the end of that chain is similar enough where I think there's some tie over. So I'll see people that have a little bit of, if they're one, they might be others.
That's the traditional Chinese.
Try the mustard.
All right, Pat.
Try the mustard and I'll microwave my beer from now on.
No.
All right, buddy. Hey, thanks for calling.
Thanks, Dr. Steve. Thanks, fellas.
Okay, buddy.
Good luck.
Have a good night.
Later.
All right, cool. Hey, that worked.
Fabulous. We're 1 for 1.
I know. Can we stop now? No, we have 29 minutes to go.
Oh, boy.
I need to retweet this. Let's see. How the hell do I do that?
While we're waiting.
Yeah,
what a
go
great
ahead.
baseball
Did you give
town.
out the correct number?
What a great baseball town. Boston. Man. What a great town. Great town.
Oh, it is. It's a dynamite. It's a dynamite
fabulous
city.
place.
I love
It's
Boston.
Fabulous. I started an orthopedics, and I think I told you that orthopedics and sports medicine program up there. That's specific to acupuncture and China.
Is that right?
Yeah, and I just love Boston.
Cool. 417 area code. You're on the air.
Yeah, Dr. Steve. Thanks for taking the call.
Yeah, man.
I'm a little concerned about my kidneys after long-term ibuprofen use. I mean, like 10 years worth of.
Okay.
Like a 600 to 800 milligram use.
Yes.
Every 6 hours or whatever.
Sure. What are you taking it for?
What?
Why are you taking ibuprofen? What symptom are you treating?
I have a multi-lumbar fusion, and my neck is fused, and I have actually several cadaver parts in my left knee.
Yeah. Okay.
And those are kind of band-aids, to be honest with you.
Yeah. Okay.
And at times, God, this sounds horrible. My urine smells like almost sewage.
Okay.
And I've gone to taking cranberry pills.
Okay.
Then cut out caffeine. And sometimes it gets better, but sometimes it still does. I mean, is this something to really be concerned about?
Well, here's the thing. A doctor can easily tell if you're having damage from the ibuprofen to your kidneys by doing a simple blood test. So I highly recommend that be done on you once a year as part of your yearly screening. Ibuprofen is generally considered safe, but you're not incorrect that non-steroidal anti-inflammatory medications can have some adverse effects on the kidney. But I've had patients who have taken ibuprofen every day for years and years and years and years and years and never did anything. So there are some host factors involved. In other words, some patients can do it and some can't. It's just like some patients can smoke their whole life and die at 90 with a cigarette in their hands, and some people, get cancer when they're 40 and don't make it to 40 and a half.
Mm-hmm.
And
is that sewage smell? Is that kind of bizarre?
It is kind of bizarre, but usually, funny smells in your urine have to do with things in your diet. More, that's not a sign of kidney failure necessarily.
Okay, well, that helps me.
Now, we have a traditional Chinese medicine specialist here, and that's Dr. Scott. Now, he deals with weird symptoms like smelly urine and stuff. What do you think? Is this part of your practice at all?
I see. I'm sorry, I see renal failure, but I would. Is your urine really discolored, or does it just smell funny?
Sometimes it's been fairly dark.
Okay,
I wouldn't say the classic tea color. Or
do you have diabetes?
Whatever, not that I'm aware of.
Okay.
I would follow Dr. Steve's advice.
Yeah, just
go get a urinalysis.
See your doctor. They'll do a urinalysis
and get a blood workup. That's what I would do for sure.
And we want to make sure that you don't have an infection in your urine.
Any prostate?
You could have a chronic prostate infection. It could be just something that you're eating. But if they do a blood test called a complete blood count. I'm sorry, not a complete blood count. If they did a
BUN,
a complete metabolic panel,
right,
and then do urinalysis. If both of those are okay, you just have stinky urine.
Yeah, and hopefully it's something you're eating.
Urine?
Yeah, you just have stinky urine.
Hopefully it's something
that would be
you're
my
eating.
diagnosis.
Yeah.
Actually, that was my nickname in high school.
Yeah. What up, stinky urine?
Yeah,
all right, man.
Hey, but I appreciate your help.
Yeah, email me at weirdmedicinexm@gmail.com and let me know how it turns out, okay?
You bet.
Okay, buddy. We'll see you. We got another call coming in. 978 area code. You're on the air.
Hey, Dr. Steve, how are you?
Good, man. How are you?
Good. I just saw GVAC said you guys are taking blind calls. I was just wondering what causes blindness.
Wow.
Wow, there you go. Nice one, Bill.
Well, there's a lot of things, and I'm going to treat it as a serious question, even if it's not. P.A. John has type 1 diabetes mellitus. One of the things that he's worried about.
No, I don't. You do.
He's not near as worried as you are.
One of the things that type 1, particularly type 1 diabetics, worry about is blindness. And you want to talk about that a little bit? About your yearly screenings and all that shit that you have to do?
Yeah, sure. One of the biggest problems, complications with the type 1 diabetes would be diabetic retinopathy, which the retina... I don't know a whole lot about the eye. I just go and listen to what the eye doctor tells me.
Okay.
But for the most part, the retina is the nerve, or part of where the nerve and the blood
What's
supply...
the sensor?
And the blood supply comes in
It's
through...
the sensory chip. It's just like your whatever those fucking chips are in your video camera.
Video camera, okay. And it's in the back of the eye, and it can sometimes get damaged because of high and low blood sugars.
Right.
And so...
Well, sugar builds up, in the small vessels. And basically what you get is destruction of the small vessels of the eye. And there aren't any real big vessels in the eye. There are a few that are larger than others, but they're all small vessels.
And then the body tries to compensate for that and produce new blood vessels.
And that makes it worse.
It makes it worse. And so the way they prevent that, and what I have had, is laser surgery where they burn the back of the eyeball and, to some degree, the periphery with laser treatment to make the body say, hey, there's no more tissue to grow new blood vessels into, so we don't have to grow new blood vessels.
Yeah.
And then, but it also causes some blind spots.
Yeah. Do you have some? I mean, can you notice those?
If I had a test, like looking at you, I see all of you.
Yeah.
But if I had a test where you had to focus on a dot and they blink a light, and then you have to say yes, you see it, or no, you don't. Oh, I've already got. Yeah, I've got some blind spots.
So your peripheral vision is in.
The periphery, actually, it's decent, in my opinion. I mean, as far as the tests go, I think it's okay. But the surgeries have done me well. I had those in the early 2000s.
It just stops you. The majority of your vision is okay. There are blind spots, but the brain just fills those in.
Right.
What it would do is keep you from seeing a bullet coming your way, which is going to kill you anyway if it's coming in that direction. So, you're fucked no matter what. But,
Part of it is...
but that's all it really stops you from doing.
And then night vision is affected, and not so much with driving because you can obviously put your bright lights on and that sort of thing. But if my boy wakes up in the middle of the night and he's 3 and I have to go into the bedroom, I can't see shit.
Yeah.
And I stumble over to the bed railing and I have to put my hands into the crib and I don't know if I'm touching his ass or his face, and I'm like I have to palpate him down, and I'm sure that my wife walks in.
So his wife walks in, he's fine.
Wife walks in, I'm like, where the hell's the kid? And she's like, he's standing right beside you. I'm like,
are you still using my crib, by the way?
We're in the process of purchasing a big boy
just
bed.
Curious.
Yeah, because we still have it.
So
we haven't sold it.
But here's how you can go blind. There are several pathways in the eye. There's the eye itself. So light has to pass through the cornea, then it has to pass through the iris and the lens, and it has to hit the retina. Any of those things can be damaged, causing blindness. Then from the retina, there's nerves that carry the impulses to the brain, and so any pathway in there, a nerve damage can cause blindness. And then there's a part of the brain where vision is detected, and you can have a stroke there and not see things. That's called cortical blindness. So anything along that pathway can cause blindness.
So physical damage to the eye, the blood vessels, the optic nerves, or the brain center that controls vision.
In the back of the head.
In summation.
Does that answer your question, bro?
Thank you very much.
Thanks for calling.
Good hearing from you.
And
was that one of your friends?
That's the famous Bill from Boston.
Too much masturbation.
Oh, boy.
Too much masturbation can cause blindness.
Everybody's hands on deck.
You had to say it twice. That's the thing.
I thought I was talking over top of it. Too much masturbation.
Hi, Dr. Steve. My name is Casey. I had a question. Throughout my life, whenever I had sexual intercourse, if it went for a really long time afterwards, I would have, right outside of my my pussy, like your actual hole, there would be almost like a lump, like a swelling, and it was like internal, almost like, I don't know, maybe like it was like a buildup of liquid, and I'm supposed to squirt and I don't, or I don't know, it's odd, but it's happened my whole entire life. And I once read in like a 17 magazine when I was a kid, like somebody had called and they had written in and had the same problem, and the person had said it was fine, it can happen, but I just didn't know if you've ever heard of it or if you had like a better explanation for it.
Can I try?
Thanks.
Yeah, absolutely. Go.
Best phone call ever.
Bartholin gland? Bartholin cyst?
I think so.
Dang, remember the last time I was here?
That's right. Here we go. Wait a minute. Let's see, I'm not as good as...
Give yourself a bill!
There you go. There is tissue around what's called the vestibule of the vagina, and it is erectile tissue. Okay, it will fill up with blood just like penis tissue does when you get an erection. And there are several glands around there, Bartholin glands and Skene's glands. And if you look really closely, you can see if you pull the lips apart very gently and look with a jeweler's loupe, which is an interesting visual, you can see these little exit holes where these glands are supposed to discharge. Now, some people think that women who are squirters are discharging fluid through large Skene's glands, and if the outlet is small so that the fluid can't get out, she may actually be attempting to squirt but can't do it because the fluid can't get out, and so she gets this big enlarging cyst there that persists for a while until the body kind of resorbs that fluid and then goes back to normal again. Or it could just be simple erectile tissue of the vagina. She could just have more than a lot of women do and have, a lot of blood flow to that area, and it just gets kind of big. Or she could, like P.A. John said, have a Bartholin cyst, which is actually a fluid-filled cyst, just adjacent to the vagina. The question is, why does she only feel it after sex? Maybe that's the only time she's got her fingers down there, or maybe it is something that comes and goes.
I kind of like the diagnosis of pussy hard-on.
Yeah.
Yeah, it sounded a lot harder when she called it her pussy hole rather than all these medical terms you guys are throwing around.
Well, we love to ruin it.
We've been doing that since 2007.
Hey, Dr. Steve, this is Mike. Yeah, I just wanted to ask. I'm like in the process of quitting smoking, and I wanted to know if you felt that it's better to use like an aid like Nicorette or the patch or Chantix, or is it better to quit cold turkey? I've been seeing a lot of stuff online that's been saying quitting cold turkey is the best way to do it. So you're not dependent on the nicotine. But if you could.
Okay, well, it depends.
Depends.
It depends on the person. I tried quitting cold turkey time after time after time. People who have listened to the show for a long time know that I smoked 3 packs of cigarettes a day. And I quit at least a dozen times, and finally it stuck. But I used Zyban. I used Zyban the day it came out. It was released in the United States on Tuesday, and I started taking it Tuesday night. And it really worked for me. It was the one thing that worked. But what they found is that the more times you try to quit, the more likely it is you'll be successful to quit. So whatever you use, just don't stop trying to quit.
Wow, really?
How much time do we have?
15 minutes.
I was going to say, write down the times that you do smoke. So if you're smoking a pack a day, that's 20 cigarettes a day. And so if you write down, that's a lot. But if you can break it down to half a pack a day, then you know when you're smoking, and it's usually a routine type of thing. So substituting things.
I smoke 2 before I hit the showers every morning, and I burn my dick so many times flicking into the toilet.
Yep.
Between
you know what I do, actually, like John's saying, but I write my patients want to do a smoking cessation. I write them a prescription for cigarettes, and I give them a little baggie, and they have to put the amount of cigarettes I want them to have for that day in that bag, and that's it. They can't go back.
Yeah.
So it just tapered down. But
well, you can taper by number of cigarettes,
right?
Yeah.
And then it's up to you. When are you going to smoke them? You going to save them all up and smoke them at the end of the day, or you going to, or you can taper by time. And now that worked for me.
Yeah.
The first time or the first day, I didn't smoke the 2 before I hit the shower.
Yeah.
And my penis thanked me for it.
You just have good aim with it.
Well, I mean, if you smoke every single day, 365 days a year, and you're flicking 2, that's 700 or 800 and something, right? Well, whatever, 365 times
730.
730, thank you.
Somebody help us.
So that's 730 flicks or cigarettes a day. With how many flicks you're going to do? Let's say 5 for each one. So that's 3,500 flicks. You're going to burn your dick at least one time. If it's just 1 out of 3,500, you're going to burn your dick once a year.
It's one time too many.
So if nothing else, stop smoking so you don't burn your dick.
So I would I would smoke. I would give up the 1 in the morning, or the 2 in the morning. Then I gave up the 2 on the way to work, and then the 2 from the hospital to my office, and then the 2 I would smoke in the morning between patients, and go time-wise. And once you get to 6 o'clock at night, you never can go to 5 again, and you always have to keep pushing it forward until that one day when your last cigarette never happens, and then you quit smoking. And the advice, the best advice I can give to somebody is when you quit smoking is fucking act like a non-smoker. Non-smokers don't let people smoke in their car. They don't let them smoke in their house. They don't have ashtrays all over the house. They don't have lighters. They might have one,
big
lighter,
long stick lighter to light candles.
Something like that.
You don't go outside with your friends who are taking smoke breaks.
No, they don't. Non-smokers don't do that.
Yeah, because I was a Copenhagen addict playing collegiate baseball, and I did the same thing. I went down from 5 dips of Copenhagen a day to 4 to 3, and that's all it is.
Yeah,
and it's intent too. You have to have intent.
And GVAC, you still smoking?
Oh yeah.
Yeah.
I've quit about 37 times.
Yeah, well, 38 might be the one. Seriously.
I've done, I think I've done everything except something like Chantix, like a pill or acupuncture. I have two buddies of mine.
I'll stick some needles in your ear.
That were heavy smokers for one 25 years, one for 30 years. One guy 3.5 packs a day, one guy 2.5 packs a day. Heavier smokers than me.
Yeah.
And that laser acupuncture worked for them. Yeah. Both of them, it's been years and years, not even a single craving, they say.
Yeah.
But I've done everything but that. I've done cold turkey, I've done hypnotism, I've done the patch, I've done the gum, I've done the lozenges, you name it.
Well, I want to make that a weird medicine project, get you off the cigarettes. And, here's the thing.
New research shows that smoking can cause your penis to fall off.
Well, and he's not wrong about that. That's
really
actually true. There is...
you got his attention.
There you go.
I didn't get
it. That's what it
The
takes.
thing that made me quit was exactly that. It's not the cancer didn't bother me. It was like, well, hell, that'll never happen to me. The heart disease didn't bother me. What bothered me was the fact that the number one reversible cause of impotence in men over 40 is tobacco abuse.
There you go.
And when I started thinking about that, it's like, fuck, I need to quit.
You know why I quit dipping Copenhagen? I was afraid I was going to wake up and I'd have facial cancer. How am I going to, get a beautiful girlfriend or wife
with half a face? Half a face, yeah.
And that's why I quit. And that's
in the old
terrible,
days, they used to actually...
Is it you chewed? Or?
Yeah, I used to dip all the time. I did a topic on smokeless tobacco and cancer.
And you saw some of the pictures?
I actually saw a case where they had this kid that was full ride scholarship to college to play football, and noticed this little place in his face. He was going to be the next big thing, and all of a sudden that little place on the inside of his cheek turned out to be big cancer. He lost his tongue and part of his lower jaw, and couldn't talk, couldn't strap on a helmet. I mean, this is a big, good-looking dude who probably had he could have pulled all kinds of ass. I mean, it was just like he had it all. And it was gone, just like that. And I said, well, if it can happen to this dude, why wouldn't it happen to me?
Right. So quit smoking.
Quit smoking.
Quit chewing tobacco. Quit fucking around and just do it.
Yeah. There's too much research that shows that it's bad.
Really?
Really bad.
So enjoyable, though.
There's other enjoyable
They knew
things
about it in the 1920s. It was bad for you.
Yeah. There's other enjoyable things you can do.
But the general public didn't
absolutely.
know. 508 area code. You're on Weird Medicine.
How we doing tonight?
All right. How are you doing, man? Sorry to keep you waiting.
I can't complain. No problem. The dick burning story is always great.
What can we do for you?
Well, my question is, dry skin in the wintertime in the Northeast. Every year I get dry skin that itches like a mother. Same spot on my legs every single year, and goes away once springtime comes.
Yep, me too.
Me too.
Here's the only thing that I've found that, and it's because cold air. I used to live in Vermont. And so it was way worse there than down here in Tennessee. But I still get it here, if we have a cold enough winter. And cold air just can't hold as much moisture. The moisture falls out of solution, and you have cold, dry air. And then what that does is it leaches the moisture out of your skin. And what I found, and you're going to think this is fruity, but the best thing for that is Nivea cream, which is what Cindy Crawford and the supermodels, they use a jar of it a day, just slathering it all over their skin. And they may say what you will about their IQ and stuff. I don't know how some of them are smart, some of them aren't, but they have a very high IQ when it comes to shit like personal care. They have the highest IQ that there is when it comes to personal care. And Nivea is the shit.
Yeah.
But you got to put it on twice a day, morning and night.
Now, this is coming from a guy that's holding a drink with fruit in it. So, let me give you my advice. A man that just drank a beer.
A real beer.
Yeah. Increase your water content, because hydration of the body will also help with hydration of the skin. So, that helps as well. But also a lotion.
Fair enough. And then
every type of lotion and drink a lot. It just every year it comes back and just won't go away.
Yeah.
And you said you get it mainly on the legs, right?
Oh, it's like 3 spots around the leg.
Yeah, that's where I get it too.
You drive? Do you?
Yes.
Are you a driver?
No. Not, just driving to work.
Oh, all right, yeah, because I noticed I always get it on my legs, and then I realized I always have the heat blasting on the bottom on the floor, and I said, that's probably drying me out twice as fast as well,
Yeah, sure.
Environmental, yeah.
You said it's 3 small spots?
Yeah, I mean, both sides of a quarter. in each spot.
Yeah, that's the way mine is too. It's patchy.
That may not be a fungal type of.
Well, but it's weird. You would think a fungal rash would come during the moisture. Would get worse during the summer and maybe get better during the winter or not get better at all. A couple of things you can do. Dermatologists have these things called emollients that they use, and you could see a dermatologist and let them give you some of these, and they are intense, hydrating, and they also cover the skin and not allow water to escape from the skin. And so if Nivea and all that stuff doesn't work for you, then a dermatologist would be the place to go. And like John said, if it's always the same area, maybe they need to take just a little scraping off that skin and just make sure that you're not missing something.
Right.
Yeah, and the other thing is that maybe a little Vaseline, creamy Vaseline, and wrap it with like some like cellophane.
Yep.
And I'll keep it really moist for 24 hours or so, and that might help.
Yeah.
I tried the Vaseline intensive care, and it just, twice a day, 3 times a day. Tried it all, but
was it creamy, or did you try covering it?
I never wrapped it in like cellophane or anything like that, but just
try wrapping it
really thick.
That's one thing that the dermatologist will do is do occlusive therapy. Sometimes that's what they call it. And you can use cellophane or there's Tegaderm and other things like that to just cover it up to get to intensely hydrate that skin. But you can fart around with this stuff on your own, but don't listen to us. Go to a dermatologist if it's really bothering you, and they've got some stuff. And John's showing us his little patchy scales.
I think that's just where my arms have been resting on the table.
All right, man. Hey, thanks for your call.
Yeah, you have a good night.
Yeah, let us know what you find that works, okay?
I'll do that. Listen to you every time you're on. So
okay, buddy.
Especially on Opie and Anthony.
Awesome. That's very bizarre. I never think that anybody's actually listening to this shit. So I really appreciate it.
A lot of us out there that do,
Cool, man.
Fabulous.
Thanks, Still hard to believe, but thank you. All right, cool. What else we got? What about, were we going to talk about the neti pot?
Yeah, we're going to sinus infections.
We were talking about that earlier.
Tis the season. We're getting close.
We've got 4 minutes and 49 seconds. You think you can fill it with neti pot talk?
Oh, I know I could.
All right, I'm out.
Yeah, I'm out.
I can extol the virtues of the neti pot for days upon end.
Yeah, John sends me sinus infections, and I send him broken things.
Well, okay,
that's the way it
let's
works.
talk about this for a second. So you, as a traditional Chinese medicine practitioner, you recommend neti pots, and in fact, you don't necessarily recommend that people use the saline solution that they sell with it. You have your own proprietary blend.
I have my own proprietary blend that I do make, and it's made up of 4 Chinese herbs with a little bit of salt and a little bit of baking soda. And the thing we were sharing before the show was that I tell people, if you use a neti pot, the problem that a lot of people run into is they pour too much of that liquid into their nose, and it only gets into their nose. It doesn't actually kind of perfuse their sinuses. So what I encourage is just using a little syringe and just a couple drops in each side of the nose, a little sniff. Let it try to get back into the back of the throat.
What herbs do you put in this stuff?
They're leafy herbs. One's, and I could say it in Chinese, but nobody would understand what I say.
That's fine. Say it in Chinese.
One is Song'erzi. One is Xinyanhua. One is Feng Feng.
Oh, I just took a Xinyanhua.
Yeah, Xinyanhua. And I know if there's any people that speak Chinese, they're going, what the hell is this guy saying?
There's nobody listening.
There's nobody listening, so it doesn't matter. But I will tell you this. And what it does, they're antimicrobial, and they dry the sinus passage out as opposed to...
But don't you get chunks of leaves in your sinuses?
No, it's a tea. I make a tea.
Oh,
yeah,
okay,
it's fabulous. But, you take away the ability for an infection to grow as opposed to a microbe or antimicrobial therapy. So what we're doing is we're just taking the mucus out, and then you can't have a sinus infection because there's nothing for it to grow in.
You're boiling this stuff and making a tea, and then you strain it and give it to them?
Absolutely. Yep.
Okay.
But I give it to them in a dry form so they can make it their own. That's the only thing I compound.
I just wouldn't trust anybody to do it right.
Oh, man. No, I do, and it's wonderful. Typically, I'll get people, after they've had 2 or 3 rounds of antibiotics and steroidal therapies, they'll come see me, and I'll wash out their head. They do really well.
Bring me in your mix. I want to try it.
Absolutely.
Because I just use the traditional baking soda and saline, but I haven't had Like
Well,
I said,
I can mail you some.
Sniffles, sneeze, cold. I have not had any sickness in 4 years since I started using the Neti Pot daily.
I can mail you some. We can get in there deep.
I had a whole collection at ronfez.net of Neti Pot pictures. They may still be up there. I haven't been there in a while. But it was just go to ronfez.net and go to the Weird Medicine Forum if it's still there, and search Neti Pot. And I had all these pictures. The GVAC and I collected a few of them of just because people look so incredibly stupid.
Oh yeah.
You know, with their head turned sideways and the Neti Pot going in one nostril and water draining out the other one.
Oh God!
But it's fantastic. People go, "Oh, I could never do that. I'll feel like I'm drowning." No, it feels great.
Yeah.
It
almost
really
sounds like a colonic from the other end.
No,
Yeah.
The thing is,
It is a colonic for the nose.
there were 2 deaths related to Neti Pot.
They
got
claim
clean water.
Yeah, they claim it from Louisiana. That was
Right.
bacteria in the water.
It was amoebas.
Yeah.
It was amoebas.
It was an amoeba in the water.
I'm terrified of amoebas in my nose because they climb up into your brain and they will eat your brain.
Well, it was in Louisiana. They must have been using swamp water or something. I mean, but they were using whatever.
Distilled water.
Or boil the water.
Boil the water.
I boil my water.
Right.
And,
Me
oh,
too.
by the way, let it cool down before you put it into your nose.
Yes, do not pour 212 degree water up your nose.
Boiling water in your nose. Don't be stupid.
Because then they'll be calling me and complaining.
Now, next time, when we come back, next week, we're going to talk about the New York teens that have developed this Tourette's-like syndrome, and we think that we have an answer for that. And we're going to talk about maybe the female G-spot, and there's a great story from the Throckmorton. It's throckmorton.me, which is the website that does what we should be doing on our website, which is all weird medicine news, about which is worse, getting hit over the head with a full beer bottle or an empty beer bottle. So, and we'll talk about that on our next show. Thanks always go to P.A. John and GVAC and Dr. Scott. We can't forget Eric Nagel, Opie and Anthony, Ron and Fez, whose steadfast support of this show never goes unappreciated. Many thanks go to our listeners whose voicemails and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Comfortably
Weird Medicine. This has been Weird Medicine with Dr. Steve. Weird Medicine. Got questions for him? Visit him at drsteve.com or call 347-766-4323. That's 347-POOHEAD. Our real phone number, chosen by a grown man in the medical profession. Sirius XM.